Oftentimes, understandably so, people are very, very excited about birth and pregnancy. But one thing that's kind of oftentimes overlooked is that sometimes that can be significant problems as it relates to pregnancy and childbirth. And sometimes the problems are to the extent that the mother either gets sick or even passes. This is particularly true for African American women. Well, that's the bad news, but the good news that with the proper education and care, these problems can be addressed. So oftentimes the community doesn't think enough about maternal health as it relates to the kinds of activities and programs and actions that should be involved and associated with pregnancy. So today we're going to talk about that. This is a call to action. I'm your host, Alex Habersham. We're going to talk about some approaches and dynamics that, and some statistics to help address the problems with maternal health. And again, ladies and gentlemen, we have with us Dr. Patrice Walker, and she's going to assist us in discussing some of the approaches that can be used to try to address this problem. I mean, even to the extent that people die, and unfortunately, African American women seem to suffer more than their counterparts. How you doing, Dr. Walker?
I'm doing well. How are you?
I'm outstanding. And this was such a problem to back during the first of the month. You all even had a forum called Conversation and Connection in an effort to impart additional information as it relates to the problems in our community with maternal health. And like I said, unfortunately, people don't realize that. You know, a lot of people take it for granted. They become excited when people get pregnant and things of that nature and not know that possibly there are many, many problems that are associated with and they are heightened by the lack of the proper care and proper education. So talk about that a little bit.
Absolutely. So you referred to our recent events. Actually, we've had two events this year. We had one in the spring in conjunction with Mercer University School of Medicine, and then we just had one very recently in November in conjunction with Fort Valley State University. And the two events were the same. We invited the entire community to come out. So this was not just for healthcare, people in the healthcare field. This was for anyone, not just people of childbearing age, but anyone, because we all are stakeholders in the health of our mothers and our babies. But we wanted to have a conversation. We wanted it to be interactive and educational. So we had a panel of expert people. Was a moderator, but I also did a very brief training on something called unconscious bias. And so we included that because we believe that that is an aspect. That's not the only reason, but that is an aspect of why why we are, today. So we included the training. We had an expert panel of people that included physicians, obstetrics and gynecologists, representative from the Department of Public Health, a certified doula and breastfeeding coach, or breastfeeding expert. And we also watched a film. And this film, man, we need to figure out a way to incorporate this into a call of action somehow. We need to have another event with you, Mr. Habersham, because it's a brief film. It's about 20 minutes long, but it is so well done, and it tells the story. It tells a story, an example of a story. It's not a true story, but it's a fictionalized version of events that happen every single day, and it tells the story of a woman who's pregnant and her family and the experience that she has as a pregnant Black woman. But it's just so well done. It's got a great soundtrack to it. It just feels like this is somebody that I know, this is a friend of mine or a family member of mine, and you really get to see the world through her eyes and her family's eyes. And then afterwards we debrief, and we've had people, cry and have really strong emotions after the film. And so we pack all of that into about a 90-minute session. Sometimes we run over that because we have a lot of conversation, which is the whole point. But it's virtual, so we do it Facebook Live, as well as you can come in person and do it. And we have several other of those events planned in 2023. So we're just really excited to partner with the community, partner with some of the colleges in the community in Middle and South Georgia, because we understand that as healthcare, as a healthcare system, Atrium Health Navicent, we can't do it all by ourselves. We have to partner with our community, with the people that are in our community, to really help change some of these statistics that you referred to.
Well, it just seems that, and I know that there's a problem, or there seems to be a problem in people not particularly uh, young women who are thinking about getting pregnant or who are pregnant. I think that too many of them, I started to say us, too many of them, don't really understand the intricacies and the complexities of being pregnant and carrying a child, and the actions that they should take, and the nutrition and the care. So just talk generally, if you would, about the steps that a pregnant mother, a pregnant individual should take to kind of address and minimize the potential problems that she may have as it relates to pregnancy.
Absolutely. And in fact, it starts before pregnancy. It really starts when you're thinking about, perhaps being pregnant. Now, we know that in many times pregnancy is not planned, and that's okay. But I mean, what it really comes down to is we need to be living our lifestyles in a way that is the healthiest, whether you're planning pregnancy or not. And that's what it really comes down to, making sure that you have your regular health checkups and health maintenance, have your blood pressure checked, and have your age appropriate screenings. Many times when you're young, you feel well, so you don't go to the doctor regularly. But when you are young and healthy, then that's the time that you want to maintain that, right? We don't want to wait until you've developed a medical problem to figure out, oh man, I should have been worried about this years ago. It's kind of, the ship has sailed at that point. So the biggest thing that I could recommend for women and for everyone is to really just schedule regular screenings and regular visits with your physician, so that what your health is. And once you have a diagnosis, it becomes even more important, if you know that you're still of childbearing age, to make sure that you are taking whatever medication or whatever treatment is being prescribed by your physician. And if you feel like you're having side effects or symptoms where you can't tolerate it, that's a conversation to have with your physician or healthcare provider. Many times we'll just stop taking medication because we don't like the way it makes us feel, or maybe we don't think we need it. But those are all conversations to have with your physician. Maybe you can't afford the medication. You would love to take it, but you can't afford it. So there's so many things that can impact people's health baseline before they get pregnant. And then once you are pregnant, you really, really need to have prenatal care established early in pregnancy. Most obstetricians won't see you before you're 6 weeks, unless you have, some kind of, medical problem before pregnancy. So 6 weeks is kind of that start. And then you want to maintain your prenatal care throughout pregnancy. I know out in the community, sometimes it seems like you wait for a long time, you get to the back, and the visit is really short. And so you think, man, I don't know what they did. It didn't seem like they did a whole lot. Why do I even need to come? But even if the visit is short, I really have to stress that there's very important things that they do in that short amount of time. Is looking at your blood pressure, your weight, listening to the baby's heartbeat, measuring your stomach, all of those things that seem very simple and don't take a lot of time tell an OBGYN a tremendous amount of information about the health of the mom and the health of the baby. And so even if it's a really quick visit, it's an important visit. And I just can't stress enough that if you have barriers to either coming to the doctor or getting, the appropriate prenatal care, that's something that we at Atrium Health Navicent can help with. And so we don't want people to just not go because they don't think they have any options.
Yeah, and that's particularly true. And it's almost staggering when one looks at the statistics to see how much more greatly African American women are affected by problems with pregnancy. And I know that there are a whole lot of factors that contribute to it. And part of it is we're trying to address today with education. So talk a little bit, and then maybe somebody is listening who's pregnant or who intends to get pregnant, or they know somebody who's pregnant or intending to get pregnant. Talk some about the resources available, because let's just be honest. Many times, and I want to talk a little later about unintended pregnancies too. But many times it's just not only the lack of the education, but the lack of resources or the lack of the knowledge of resources that are available to, some of these young folk and old folk and what have you pregnant, and they don't have the money. So are there any resources that can kind of assist, even though they may be economically challenged?
Absolutely. So we're really lucky. And you know what? Before we get too much further, we've been referring to these statistics, but I definitely want to take a minute to say some really high level numbers because, there might be people out there thinking, well, is it really that bad? I don't really know anybody that's had a bad experience. So can it really be that bad? It really is that bad. The state
Wow.
of Georgia has the second highest maternal mortality rate in the United States. So out of 50 states, we're number 48. And we waver, we're always somewhere in the high 40s. And that's not a statistic that we're proud of in the state of Georgia. We think this is a great place to live. I think this is a great place to live. I was born and raised here. And that's not a statistic that I'm proud of as a Black woman, as an OBGYN, and as a healthcare provider and a hospital administrator. That's not how I want to be represented. But then, so that's for the whole state. But then if we look at Black women in our state, Black women are 3 times more likely to die from pregnancy related
Wow.
complications than their non-Black counterparts. And so we're talking about the state of Georgia being bad, but even within the state of Georgia, if you're Black and pregnant, then the statistics are even worse. So this is a very serious problem. That's why I'm so excited to be able to talk about it today. Now, in terms of resources, what are we trying to do as the state? When you are pregnant in the state of Georgia, you have access to Medicaid benefits. So if you have no other form of insurance, you have access to Medicaid benefits for the duration of your pregnancy, not just the duration of your pregnancy, but also after your pregnancy. Initially, it was 6 weeks. Then us in healthcare said, that's not long enough. So it was expanded to 6 months. And recently, I believe in the General Assembly for this year, they expanded that to 1 year postpartum. And so, because we realized that after pregnancy, there's ongoing care that's needed, especially if you've had a complicated pregnancy. 6 weeks is not long enough to continue to get that care that you need. And so, not every state has that type of program, but we have it here in the state of Georgia for pregnant women.
So you're telling me that with or without insurance, with or without the proper financial and economic resources that one would need to receive care, maternal care, that there is a program? Are you telling me that there is a program that these young women or whomever can go to and apply for and get free benefits and free care while they're pregnant to assist them through the kind of problems and prenatal care and what have you, so they can be more likely to have a healthy baby. Not only that, because I don't think we need to just pass over the fact what you said as it relates to several people dying. Um,
Absolutely. And let me be clear. So that's if you don't have any insurance, there's Medicaid, but also if you have insurance but perhaps are underinsured, meaning your insurance isn't great, it has some gaps, it has some holes, maybe it's a high deductible plan, whatever it may be, you still can apply for Medicaid to use as a secondary insurance in addition to whatever insurance you may
wow.
have through your job. So there's really no excuse in terms of a being able to pay or have a payer source for pregnancy and pregnancy related care. There's no excuse for women in the state of Georgia to go without prenatal care.
That's very, very true. And then the other thing I think that's important that may need to be encouraged. By the way, this is a call to action. I'm your host, Alex Habersham, interviewing Dr. Patrice Walker, OBN, OBGYN at Atrium Navigant Health. And we're talking about maternal health. We're talking about maternal health. And it's so important because women are dying, babies are being born, disabled, sick, and there are resources available to kind of prevent that and address it. So that's what we are discussing. So, uh, is there a resource? I mean, I think much of it is education, as you know, and that's why we are doing this. So, in addition to the financial assistance, is there a resource that if a young lady or somebody is pregnant and they say, "Well, I want to learn more about my pregnancy. I want to learn more about maternal health." Where should she go to try to find out uh, what was going on?
Well, I would say first and foremost, go to your OBGYN. They're going to have the best resources that are specific for you and for whatever may be your, specific, health conditions. So that should be your number one resource. But if we're talking about general resources, the health department has a lot of general resources in terms of if you want to hold a pamphlet or a booklet or something like that in your hand, then there's always the internet, which is good and bad. You have to know where to go. So you want to go to reliable websites like the Centers for Disease Control, the CDC. Anything with .gov after it is going to be a reliable vetted resource. I do not recommend people just Googling, pregnancy, because they're going to get all kinds of things that may or may not be true, for them. So you want to be careful, but I would definitely suggest going to the Department of Public Health either in person or online, going to the CDC website, and they will have additional links, outside of them that are reliable that you can go to. I also want to mention at Atrium Health Navigant, we have resources as well. We've actually just acquired a grant through the Healthcare Georgia Foundation. And this grant is going to allow us to hire a care coordinator that's going to work out of our high risk OB clinic. And our high risk OB clinic takes care of women that have, a lot of diagnoses that make their pregnancy such that a regular OBGYN does not feel like they can appropriately care for them. So we see women from all over, middle and South Georgia that have to drive a long way to get the prenatal care that they can't get in their community. And so this care coordinator is going to really be a huge resource for them. Not only is it going to help them navigate through a complex healthcare system. It's complex when you're not pregnant. When you get pregnant, it's even, harder to navigate through and scheduling various appointments with specialists and all of that. but this care coordinator is also going to be able to go to them as well. So it's not just they're going to help them be able to come to their appointments, but also the care coordinator is going to be able to go to them in their homes and really help them navigate through whatever, environmental or social problem that they have. If they don't have access to nutritious food, or if their home environment is not safe, they have, again, transportation issues, whatever it may be, this person will help them navigate, because our high risk pregnancy population is, those are the people that are at the highest risk for having those, poor outcomes. Even if it's not death, they have, complications that might keep them in the hospital for an extended amount of time. And so we're extremely excited to be able to have that as a resource for the patients that come through the Anderson Health Clinic, high risk OB clinic.
I cannot overemphasize the importance of resources. I'm doing that. I do that every day. I do that on every show because I think the community needs to realize that although we're talking about pregnancy, whatever kind of problem that you have, there are resources out there that are available to try to assist, us through those problems. So I always emphasize that. I mean, you could just call somebody and say, if I got this problem, whom should I call? Or something of that nature. And I think that will generally improve the community. The other thing that I want you to do, if you don't mind, a lot of people really don't realize the importance and the impact. You just mentioned, and then you can kind of tie that in again, the Department of Public Health. The public health department, and sometimes we overlook that. So just kind of reemphasize, what that entity, Dr. Smith, and the people over there do, if you don't mind.
Absolutely. We are so lucky to be a part of the Department of Public Health. And so our Department of Public Health is broken up into districts across the state. So for the entire state, the Department of Public Health is broken up into districts. And our district, the district that we're a part of, is also includes, gosh, I think there are like 9 different counties, in our district, but they're all linked under, a district director. And so each county has particular resources or has access to resources. So you may not be able to get prenatal care in every county through the health department, but some counties have prenatal care that you can get through the health department. And even if you can't get prenatal care, they have a list of physicians that they can refer you to. They can help you with WIC and vaccinations, all of those types of things, education. So and the resources there, most of those health departments should be in areas that people can easily get to. If you have public transportation in your area, like off the bus route here in Macon Bibb, you can get to the health department via bus if you don't have transportation. But I can't stress enough the resources. They have dental, you access to dental care through the Department of Public Health here in Macon Bibb. And getting dental care is an important part of prenatal care, believe it or not, because there's a link between periodontal disease and prenatal, preterm birth. So things that you wouldn't think are linked to pregnancy and poor outcomes really are. So even, if you haven't been to the dentist in a long time, that's an important aspect of prenatal care as well.
So I think the moral of that story, if you're pregnant, get informed and get educated and learn, because you want a healthy baby and you want to be healthy also. And, we got a couple other things I want to mention. One is, breastfeeding, because I think that's oftentimes overlooked. And we've done a show on breastfeeding, but I don't think it can be overemphasized, the importance and the benefits of breastfeeding. So if you would, just take a minute to talk about that.
That's right. And I agree. It cannot be overemphasized. And we all know that we just recently went through a formula shortage, right? Just a few months ago, there was formula. I mean, there were people that were struggling to be able to feed their babies. And that shouldn't be a problem. As women, we have a way to feed our babies. We can breastfeed our babies, and breast milk is really the best milk. Now, there are some medical conditions there are some women that can't breastfeed, and that is appropriate. They should have another option. But for those that can breastfeed and just choose not to, I would definitely ask you to, again, educate yourself. We have breastfeeding uh, um, classes as part of our prenatal classes here. We have childbirth classes. We resumed them. Infant safety classes that can be virtual, so you don't have to physically come. And they will teach you how to appropriately breastfeed and get the baby to latch on. So breastfeeding is absolutely critical.
Wow. So I know that we got some people anxious. And then the other thing I want to mention to the public is that if you hear this show, and if you know somebody, tell somebody. If you've got a relative or a friend or a neighbor, what have you, that's pregnant or that's thinking about getting pregnant, then I think it's incumbent upon all of us. I think we have watch this. I think we have a responsibility to humanity, to try to do better, to live better, love thy neighbor, help whenever possible, give back, and things of that nature. So, how does one access the Medicaid, the free governmental care for pregnancy? Do they go to the Department of Health, or how do you access it?
They can go to the Department of Health, and they will help you access that, and get signed up and understand what you need to do. And I agree, with you that this is a call to action, right? And so, as such, we cannot allow ourselves to be living in one of the richest countries in the world, and yet our maternal statistics are worse than some third world countries. I mean, that just doesn't make any sense. And so it is incumbent upon everyone, again, not just young people that are of childbearing age, but it is everyone, not just women either. It is men, it is grandparents and aunties and uncles and everyone, who's it's going to take to really change the direction that we're headed in.
That is absolutely true, and the statistics are staggering as it relates to mortality for pregnant women, and they are particularly even doubly staggering for African American females who, because of the lack of the proper maternal care and maternal education. And I'm going to mirror what Dr. Patrice Walker said about this. Everybody, there's a whole saying, if you see something, say something. So if you're in a position to impart some information or to help somebody or to educate somebody, direct somebody to resources, then I think that we all should do that. And I appreciate, all that you and Atrium Navison do to make this a better community. This is a call to action. I'm your host, Alex Havisham. We're out of time. And I have interviewed Dr. Patrice Walker. So get this information, tell somebody, help somebody. Have a great day.
www.makingblackpages.com